This is ADHD Annie, and this is my pilot episode of my new vlog I've started. I want to talk about my journey with ADHD, some of my other mental health challenges, also my experience with TMS. I've come across other ADHD vloggers, and it seems like you found out about your ADHD diagnosis as an adult. Well, for me, I have known about this for 26 years. I was diagnosed with ADHD at 10, and I think prior to my diagnosis, school was really tough. I always felt like I was either laughing and carrying on in class or just quietly daydreaming, and school did not come easy to me at all. I really struggled. At one point, my parents did take me to a mental health provider because I think they thought that I was depressed, and I was actually diagnosed with depression, but also with ADHD. I think that the diagnosis definitely makes sense, and it certainly provided a lot of clarity, but I don't ever feel like I was on any ADHD medication that benefited me, but I felt like for me, edged sword. And definitely it does come with side effects. I know that for a long time I was on Adderall, and then I did have to stop the Adderall about 9 years ago when I found out that I was pregnant with my firstborn. And I think I went into it thinking, well, I'm not going to be able to function going off the Adderall. Well, I certainly did not miss all the side effects. I definitely don't believe that Adderall, at least for me, is a smart drug. And in fact, of all the years that I was taking it, I still did run into problems. I still did lose jobs. I still had problems focusing. It was just a different version of me that I really didn't even like. Back to the depression piece, I was diagnosed with depression at the age of 10, and I've been on many, many antidepressants. I'm not sure if you've seen my TikToks or my shorts, but I definitely was able to capture the many different faces of the antidepressants and the side effects I was going through. That was just kind of a mess in and of itself. I feel like when I started taking antidepressants at the age of 10, it did help me for a while. I did pretty well academically in high school. And when I say I did well academically, I mean that I was just very motivated. And then I was a little bit perplexed as to what was going on, and I didn't know what to think of it. I really didn't. But I feel like I was still able to get by. I was still able to go to class. I was able to keep a job. But at the same token, my mental health was for sure busting at the seams. And I think the other piece is that I have lost a lot of jobs in my day from, I think, ADHD and depression, but the whole job loss situation is for another video. I think, in college, I was still struggling. I did eventually get my degree in health administration, but, it took me 6 years to do that. And this is another thing that I want to talk about in this video is my journey with medical coding. So I was also able to get a medical coding certificate too. And then once I started working, I really struggled big time. The time I was in my mid-20s is when my mental health started to take a turn for the worse. And I did get married, and then, I'm trying to think, our firstborn I had him 3 years after I got married. So when my ex-husband and I were newly married, no kids yet, I went through jobs like that, constantly dealing with some sort of disciplinary action, constantly on a performance improvement plan, constantly dealing with a pending job loss or a job loss or unemployment. I feel like that was the latter half of my 20s. Then when I found out I was pregnant with my son, I was able to find a job that lasted 6 years. And that was, the job that stands out the most to me because I was there for 6 years. I gravitated, I think, to that job, that specific employer, because of the fact that I knew my depression was so bad that I didn't think I would be able to handle anything else. And I think all I needed at that time was just stability. That was a pretty trying time, I think, for my depression too, because it was not getting any better. And you know, it was tough. I have 2 kids and they're 18 months apart. And I feel like their first steps and all of that, I didn't get to enjoy or appreciate that, all because with depression, you have anhedonia. And anhedonia is loss of interest in things that you once enjoyed. Where were we? I don't remember where we were, but the second part of my pilot episode. So the 6 years of employment that I had was, first I started out as a medical coder doing, you know, outpatient and inpatient behavioral health, which, by the way, I love mental health coding. I feel like mental health is so fascinating, and as a neurodivergent person, I would much rather do behavioral health versus medical. However, it's not to say that if I was offered a job today in something that's medical and non-behavioral health that I would decline it. I guess it just depends. But yeah, I really do like doing behavioral health. So I had experience doing some inpatient behavioral health and then mostly outpatient behavioral health visits. And then I also did work in medical records, which I actually liked doing that. It was for a pretty old school behavioral health system. I mean, I felt like their documentation was pretty ridiculous. They had an EMR, and to make a long story short, some of the files that we were retrieving were still pen and paper, which is like living in the Stone Age. But my position did get eliminated during the pandemic. I think it was 2021. And you know, I wasn't too panicked about it. I mean, of course, because I really liked working there and the people that I worked with, I was kind of bummed, but I was getting adequately compensated. I was making $600 a week in unemployment. And then of course, when the unemployment ran out, I had to go back to work. You know, some things happened in my personal life. I ended up getting a divorce in 2021, and then it took a while for it to finalize. Definitely went through my fair share of jobs after getting eliminated and then before taking on my current job. I currently work as a state employee and I do records. I don't do any medical records, but I do records for, you know, requests that have anything to do with roads, railways, highways, drawings, plans, materials. It's all related to road work and nothing medical related. So I don't use HIPAA much, if at all. Well, I don't use it at all with my current position. And, you know, I am looking for something different. There have been a few barriers, which I will get to. I feel like the current job that I have has given me great stability. I do like working for the state. I like state employee benefits. So, you know, the benefits actually are, you know, you can't touch when you work in a private sector. I really appreciate that. I appreciate, you know, my first year, I get 3.5 weeks of vacation time. So that is definitely very nice. And I'm also able to work from home 3 days a week, so it's a hybrid remote position. And another perk about my job, my current job, is I absolutely love my supervisor, which, Casey, my boss, if you're watching this, you are an awesome supervisor. I really appreciate it. And, you know, I can't say that about every boss at every job I've ever had. In fact, I feel like 9 out of 10 of the jobs I've had, I'm not a big fan of my supervisor, maybe because, you know, I am a woman And when it comes to workplace, I don't generally get along well with women. I feel like the majority of times that I've been thrown under the bus or stabbed in the back, it's been by a woman. 99.9% of the time, it's a female perpetrator. And I don't do well with the poker face, I really don't. And I think that I'm very transparent in my emotions, and people sometimes have a problem with that. But I also feel like with medical coding, I've found the right fit because it is remote. It's been remote pre-pandemic. Don't have to interact with people that much. And if it is, it's behind a computer. So that doesn't bother me at all. In fact, that's a benefit. Doing well at my current job. I don't anticipate being there forever because, things like roadways and projects and engineering designs, that makes me feel a little bit jaded. But again, I still feel like I have lots of job security because when it comes to layoffs and when it comes to, a recession, the state lays off no one. Whereas a private sector, I would be sweating bullets about suffering some kind of job loss. And as a neurodivergent female myself, I have already suffered so many job losses. And other than the COVID layoff at the 6-year position, these have not been layoffs, they've been terminations. And that is pretty consistent with the struggles that women and men like myself face when it comes to ADHD and ADHD in the workplace. So I know that with my last position, it was a huge mess because I was hired on to work doing insurance verification, and it was a job that I knew I was capable of. It was not above my level of expertise, and I knew was I given the proper training, I would have thrived on the job. Well, yes, with every employer, especially a female-dominated employer, there's going to be people that throw you under the bus, but I felt like that employer was just so piss poor at training people, having expectations, having clear and concise expectations. Me not knowing the expectations because they were never written out for you or in any detail versus you can't meet the expectations because you're just not capable of it are two completely different things. And unfortunately, I was thrown under the bus, and I have no problem talking about that in greater detail. In fact, I do have a recording of my conversation with the director of HR at that job, but, and I mean a big but, I can't just post it on YouTube nilly-willy. I need to find a lawyer and have him or her review it before I submit it, if I submit it at all, because I'm not putting myself at risk for a lawsuit, period. Even though I would really love to, I guess that's the thing, is it's like, this is my pilot episode. I have so many great ideas. When you have ADHD, you're never out of fresh ideas. But I guess what I'm getting at is that I impulsively want to just, upload that recorded conversation I had with the director of HR and just put it to all of you because, I have ADHD. I don't want to run it through a lawyer. I'd rather just post it. But I value my personal freedom and my employability too much to make myself liable or put myself at risk for getting sued by my previous employer. But what I can say is that my previous employer was just awful. And I had started that job. I was only there for 5 weeks. And the weird thing about this job was that you know, of course I was unemployed when they interviewed me. Oh no, I wasn't unemployed. I was working at a gas station, but I was looking for something better for obvious reasons. So I get this interview at this, it was like a stroke or a brain rehab, stroke rehab hospital. And, you know, I had my interview, it was an in-person interview, and it was with, I guess she was like an RN case manager. She was my supervisor, and then 2 other RN case managers that were in non-supervisory roles. And so I had this interview with 3 women, and they were laughing hysterically, and we were all cracking up jokes. And being someone like myself, I love to laugh and have a great time. And, you know, I had met these 3 women for the first time, and I felt like I had reunited with some best friends that I hadn't seen in a while. And they were super hilarious. They made really funny comments. They had me in stitches. And, you know, basically what the supervisor told me at the interview is that, you know, they have not had many candidates given the workforce shortage. And the supervisor also said that there were only 2 other people that were interviewed. Well, there were only 2 other people besides myself that applied for this position, okay? And the other 2 that applied and were interviewed, they just weren't remotely qualified. That's what the supervisor said. The supervisor was saying that one of the candidates had a history of working as a pastor and delivering pizzas. And then the other candidate did not have a high school diploma nor a GED. So this place pretty much hired me for the sake of filling the position and going through the boxes or check marking the boxes. Anyway, I know the next day, like seriously, the day after I interviewed, I got a call from HR saying, you know, that they want to hire me on. And I'm thinking, well, because it was a pretty rough time for me. This was back in 2022. And my kids and I were living under my parents' roof, okay? And my parents lived 30 minutes away from where my kids go to school and where my ex-husband lives. So obviously, at the time, I was doing the best I could to get a better paying job and secure a place close to where my kids go to school and, you know, that sort of thing. So I was excited at first to start this job, most importantly for the financial standpoint. And, you know, I start the job and I'm thinking, okay, you know, because fortunately this hospital wasn't too far away from where my kids attend school, and it would have been a super easy commute had I stayed, had I not been let go from that position. So I worked there, I start working there, and I mean, these women, like I would have lunch with them every single day and we'd be laughing and talking, and they treated me like I was a friend of theirs. And I think something had happened like a week or 2 into the job where I have worked in revenue cycle management. I have done medical coding. I have done medical records. I have not done insurance verification. You know, that was something I had no experience in. And this place was a for-profit hospital. So, you know, I get it. You need to be timely and do everything correctly so that the place gets paid and the hospital is adequately reimbursed. So my job was to send faxes to insurance companies because their revenue cycle, or at least where I worked, there is a timeline for everything, and that includes renewing a patient's stay so that they're approved by the insurance company. And I think the job of my supervisor was she was a a registered nurse case manager, and what she did was she didn't do much bedside nursing. She did make visits to her patients and try to assess if the patient was medically stable enough for discharge. And her job, when a lot of times these patients were very ill, a lot of them were ventilator dependent, her job was to meet with the medical review board or the medical directors to convince them that these patients just aren't ready for discharge. And then my job was to submit all the necessary documents to the insurance companies. So to make a long story short, I was very timely in sending what I needed to send to these insurance companies. I never missed anyone. However, for one patient, this insurance company is claiming that they did not receive the documents from me. And I had explained that to my supervisor. But just to back up, my supervisor, a couple weeks into my job, sent me an email saying that, organization is key and we need to talk about this. And so I talked with her and she made it sound like everything was honky-dory. And I did say to her, because what the point of the meeting was for her to let me know that, hey, I know you've been emailing these insurance agents and you've been sending faxes to them, but you can't stop after you send something to them. You have to make sure that they reply and acknowledge. Well, I didn't know that. Anyway, I said and I was a little concerned that would affect my 90-day review. And I said to my supervisor, so is this gonna hurt my 90-day review? And she said, don't worry about it. So that happened. And then I think a week later, I get an invite on Outlook to meet with the director of HR in 30 minutes. And I went up to my supervisor and said, so what's this invite with the director of HR about? And her response was, I don't know, Ann. I have no idea. And that's when I was legitly pissed off. So I met with the director of HR, and this woman wasn't really, she was nothing to write home about. I'm not ready to give my YouTubers the completely unfiltered thoughts on this woman right now, because I have our recorded conversation in my possession and I need to get the green light from my lawyer, which is something I haven't done yet. But yeah, this director of HR was just a complete buffoon. Anyway, the director of HR is telling me that this doesn't work. It's not working out and you're not getting fired, but you can no longer do your job. So her and I had talked about it, and I felt completely betrayed. I was extremely upset because I really was unaware of this upcoming job loss, and I just knew, well, the thing is that the director of HR was telling me about other openings, like there was a billing opening and there was a receptionist opening. And the thing and the director of HR is like, oh, well, given your experience, maybe the receptionist position might be a no-brainer for you. And I thought, yeah, I don't know. I think that in most circumstances or most workplace settings, I'd probably be able to handle that, but I had interviewed other supervisors and other departments after I received the unsettling news from the HR director, and I told him, how I was thrown under the bus by my ex-boss, and we'll call her T right now for all intensive purposes. So I told him what T did, and the supervisor's reaction was, oh yeah, no, that's pretty typical. And the other piece about the reception is that it seemed like it was almost as intense as being a 911 dispatcher, because you're communicating with hysterical family members and loved ones that are very upset when an ambulance is coming to pick up the patient for emergency reasons. and you have to deal with that. So to me, I'm just thinking, no, this isn't gonna work. So, and the other piece was that the billing manager person, I received some nasty emails from her when I was in my original role. And it was something to do with, I don't even remember, and I would like to just forget about it, but this billing person was nasty to me via email about scheduling a patient for some chemo, and this woman was asking me via email, this is a chemo patient, what's the exact agent, or what's the name of the drug? I understand that every job is going to have their Karens. I get it. However, I couldn't continue to go on in an organization where I'm switching to a different department all because my original supervisor, T, for the original position that I started off at, threw me under the bus. You know that's going to be coming through the rumor mill. And I just ended up resigning because I was done with them, and I did not appreciate the fact that I was being played dirty. So anyhow, you know, that was a messy situation. That was a very bad situation. And the worst part was that my divorce was pending, and it meant that I had to live with my parents a little bit longer, which was already a huge inconvenience for everyone. So, you know, I didn't even know how to explain to my kids that I no longer work there. I ended up just saying they didn't want mommy there anymore. I think for now, because I have not consulted a lawyer, that's really all I'm going to say about my experience with that job. But I think all in all, I've been let go from many, many jobs, and I think that the ADHD has been the source of all the heartache and a big reason for some of these job losses. I know the most recent job loss, ADHD or not ADHD, I wasn't given the proper training, and that's what, you know, given the powers that be, that's what ultimately ended up happening. But you know, I think I can honestly say with half of my job losses, I feel like it was deserved. And then my most recent job loss was certainly not deserved. And it was just the result of piss poor management and her dirty work. So, you know, that's all I have to say for now. And so far, this is a 25-minute video. So it looks like I will be doing lots of edits. But bye for now.